My name is Dr. Ariane Marelli. I'm a professor of medicine at McGill University and director of the McGill Adult Congenital Heart Disease Unit. The title of my presentation today was Demographic Changes in Congenital Heart Disease in the 21st Century, Impact on Management and Outcomes. During this presentation, in an approximate 15 minutes, we covered a fair bit of ground looking at the changes in the epidemiology of congenital heart disease across the lifespan. And we then looked at the impact of these demographic changes on how we have identified a growing disease burden and what mechanisms we have put in place in order to improve management. Specifically related to demographic changes, we reviewed the most recent data published by our group showing that not only by this point in time adults with severe congenital heart disease outnumber children with severe congenital heart disease, but in addition to that, when we look at the entire congenital heart disease population, 2/3 of this population are adults. And so that this puts adult congenital heart disease really squarely in the realm of adult cardiology medicine. We can no longer say this is a pediatric condition. When we look at the prevalence data, which we just published in Circulation, we have now estimates that allow us to say that we have 1.5 million people in the United States living with congenital heart disease at the current time. And we are working with the CDC to use the data that we generated in order to come up with more specific population estimates in the United States. In terms of disease burden, we have done a lot of work in the last 10 years looking at a variety of disease conditions that affect this population. Specifically during this presentation, we reviewed the shift in mortality from infancy to old age, and then we looked at some of the causes for mortality and some of the trends in the disease burden. We identified atrial arrhythmias as being a growing concern. We looked at the fact that our population has a lifetime prevalence of atrial arrhythmias of 7 to 10% from the age of 20, which is similar to patients who are 55 years old without congenital heart disease. So as we like to say, we have young patients with old hearts. We also looked at the persistent effect of pulmonary hypertension, which increases mortality. We looked at the effects of pulmonary hypertension in congenital heart disease patients stratified by age, so that despite all of the surgical procedures that have been growing and been very successful over the last decades, pulmonary hypertension remains a problem. We then looked at trends in surgical volumes and surgical operations. We looked at the growth of valvular interventions as being very important, and we presented some very exciting initial preliminary data that will be presented at national meetings next year, looking at the impact of heart failure on mortality of congenital heart disease patients. This is a growing area. We have tremendous challenges in measuring heart failure and myocardial function in patients with congenital heart disease, and so this is something that we are turning our attention to and will yield a lot more interest in the next, I would say, at least 5 or 6 years. In the latter part of the presentation, we looked at management and we asked the question, how can we change outcomes? Here again, we refer to data from our group that we just published in Circulation in 2014, looking at the impact of policy on outcomes, specifically the mortality outcome. We showed that concurrently with increase in referral rates to ACHD centers in Quebec, we observed a decrease in mortality, and we looked specifically when we analyzed this by way of survival. We found that ACHD centers clearly protected ACHD patients from mortality, and this is a very powerful message that will help policymakers make decisions towards increasing the number of ACHD centers, both in Canada and the United States. Finally, we ended with a summary and with some preliminary data on the worldwide burden of congenital heart disease in adults. This is preliminary data where we will be working together with Professor Saxena in India to look specifically at whether we can come to some consensus on what the epidemiology of congenital heart disease will be worldwide.